Hi, welcome to another one of our Dr. Foot videos. This is actually my day off and I'm in clinic. I had some paperwork to do, so I thought I'd come into clinic to do some of this paperwork. Some people say I can't stay away from the clinic. They might have a point. While I was in the clinic, I thought I'd make a quick video about a couple of patients I've seen in the last 10 days who I thought were really interesting. Now, all three of them had psoriasis and they had psoriatic arthritis. Well, I diagnosed the psoriatic arthritis. Now, just like that old analogy where you're waiting at a bus stop for a bus and none come along at all, or not for a long time, and then 3 or 4 come at the same time, it's the same sort of thing when it comes to certain patients with certain types of health conditions. Psoriasis is one of those conditions. Now, 2 of the patients that came to me had plantar fasciitis, so they were getting intense pain in the heel. One of them was getting insertional Achilles tendonitis. So let me talk a little bit about psoriasis itself. Now, psoriasis is a skin condition. You can get these red, patchy, scaly lesions all over your body. It can happen in your scalp and your legs. I'll put up a picture just to show you. It can also affect the joints. So 2 of these patients, they had random swelling of their fingers. That's called dactylitis. I'll put up a picture. But you can get random swelling of any joints. One of the other patients had random pains in her elbows and knees. Now, she went to a doctor and the doctor really didn't take her seriously, which I found a bit surprising. She needed a referral to a rheumatologist. In fact, all 3 need a referral to a rheumatologist, and I've sent off letters to the doctors to ask them to be referred to a rheumatologist to be placed on medication to have further tests. But psoriasis can lead to psoriatic arthritis, which can affect the joints. If left untreated, it can really affect the joints quite a lot. I'll put up an x-ray to show you how they affect the congruency of the joint. Now, when I did the ultrasound on these patients' plantar fascia, the fascia was thickened, but what also happened was there was neovascularization. There was inflammation within the fascia, which is not what you would normally see in a patient who had plantar fasciitis. Also, when I squeezed the heel, they found it painful, which is also not something that you would see in a patient with plantar fasciitis. Normally, when you palpate the medial tubercle of the calcaneus, which is on the inside of the heel, they get intense pain, but they don't normally get pain when you apply lateral pressure, when you apply pressure to the heel, unless they have another pathology, another type of foot condition. So that was really interesting. But I think what gave it away was the fact that they had swelling in their fingers and random pain, and they had psoriasis already. So that was really big indicator factors. What can happen with psoriasis, and when you get psoriatic arthropathy, you can get conditions that affect the fascia, the plantar fascia, and the Achilles tendon. And where it happens at the enthesis, which is the origin of the fascia or the origin of the Achilles tendon. So what I did with these patients was, one of them I gave her an ultrasound guided steroid injection into her fascia to calm down the actual pain, because she could hardly walk, poor woman. The others, I gave them orthotics to offload, and I referred them to a rheumatologist. So if you have psoriasis, beware of any random pains that you're getting. It could be not psoriatic arthritis, but it's something that you need to take serious, especially if your fingers or toes are just swelling up and you don't understand how they're swollen up, like you haven't knocked it or anything. And then you should take that really seriously. Hope you found this video interesting, and I better finish off and go back home and relax for a bit. This is my day off. Take care. Bye.